Let's talk about cesareans. The key differences between elective versus emergency cesarean sections. So elective cesarean sections, or what we call category 4 cesarean sections, are usually planned procedures and are done before the onset of labor, usually around 39 weeks of gestation, although this can vary depending on the indication or the reason for the cesarean. Common reasons are for breech presentation, previous cesarean section, things like placenta previa, or even maternal request. Now, with elective cesarean sections, there's time for preparation and planning before the procedure, and you could actually even get to meet the team, like your anesthetist, your surgeon, and have a discussion with them about the procedure and have all your questions answered. So usually the vibe is usually a calm one, and you can even choose your own music for theater. You're also usually awake because you've had local anesthesia with either spinal or epidural, and you're able to see your baby right after baby is delivered. On the other hand, with an emergency cesarean section, it's unplanned and usually urgent. It occurs during labor, although there are situations where emergency cesarean sections need to be done in women who are not even in labor. The situation in this case is more intense and can feel a bit overwhelming depending on the type of emergency cesarean section you're having. We have 3 categories of emergency cesarean sections, category 1, 2, and 3, based on the urgency of the situation, with category 1 being the most urgent, where there is a threat to the life of the mother or the baby. With emergency cesarean sections, there isn't a lot of time to prepare, and especially if you're going to have a category 1 cesarean section, there's a lot of activity usually happening around you. Sometimes the emergency buzzer is ongoing. The phones of members of the team that are within your room might also be going off, and it might feel like multiple people are trying to talk to you at the same time, because the midwife would be asking you to take off your jewelry for surgery, to try and change into your theater gown. The surgeon is trying to take a consent from you for surgery. Sometimes all we need is a verbal consent if we can't take a written consent. And the anesthetist is there also trying to do their bits before the surgery, so it can feel a bit overwhelming. Common reasons for emergency cesarean section: fetal distress, failure to progress, or bleeding during labor. Now, in terms of anesthesia, we still aim to do a local anesthesia for emergencies. However, if it's a day emergency, especially category 1 cesarean section, we might not have time for that, and so you'll be put to sleep or given a general anesthetic. Now, irrespective of whether you have an elective or emergency cesarean section, it's major surgery, and our aim is to end up with a safe delivery with no complications to you or to your baby. Emergency cesarean sections are known to have a higher risk of things like blood loss, infections. However, this is not absolute, and a lot of women would have cesarean sections with no complications whatsoever. If you have any questions about this, drop them in the comment section. And if you've enjoyed this video, give me a thumbs up, share, and follow me for more tips.